Hello everyone, this is Hina Tanjum. So this subject is pharmacy practice. This is somewhat similar with hospital pharmacy. So its first unit is dealing about hospital and its organization. It's a bit in unit 1. So in that we are going to learn about its definition, its classification, which is based on type of care and based on clinical and non-clinical basis, or you can say services or grounds. Next is organizational structure of your hospital and the medical staff which is involving in it and their functions. So generally a hospital means an area or a place or an institute which provide health related services to the patients, or you can say the treatment to the patient. So yes, it's an complex organization or an institute which provides health related services to the people through the complicated but specialized scientific equipments will be there, and it will be involving a team of trained staff which are educated in the problems of modern medical science. It means that the staff which are involving in the hospital, they are very trained and they are educated in the modern medical science problem solving. Okay, so they are involved in the problem solving of the modern medical sciences. Next, you can say you can define a hospital as an institution of community or a super specialty complex organization which produces the use of physicians, the surgeons, and a team of technical staff, and it also produces the facilities for diagnosis, therapy, rehabilitation, prevention, education, and research center. So next are the functions of your hospital. Generally, the main function you can say is to treat the patients, and the second function which we can say is that they provide training to the students. Beside that, we are having certain functions which we are mentioning over here. The first one is to raise the quality of law and the general standards of the medical to practice. Here we are taking the quality of law and the general standards. Nothing but we are seeing the rules and regulations of the medical to practice. Next is to provide the means and methods by which the persons here are the practitioners who are working in groups. They are working in groups with the object of care of hospital departments, means they are working with the goal of providing care to the patients. So here the practitioners, they are working in the groups in combination with the patients and community, means they are working in combinations, means they are providing care to the patient, yes, but with the help of means with the cooperation of the patient and the community, they won't be able to work properly. Means for smooth running of an organization, it is very important there should be a cooperation between the practitioners as well as the healthcare takers. Okay, so next is it lowers the incidence of the diseases through the early detection and by treatment. It also estimates the needs for facilities, the supplies, the equipments, and then they are utilizing these needs of the facilities for evaluation, control, and maintenance. And it is acting as a link between the general public and the policy makers. Next is they are involving in the estimation of the requirements of the department. Whatever will be the requirements of the department, they are estimating it, and then they are recommending some policies or procedures for the maintenance of the staff, for the maintenance of the adequate as well as the competent staff. So it is very important to maintain adequate and competent staff in a hospital to run it smoothly. Next, it also involves in the growth of medical science, whereby the doctors and the nurses receive their training in large teaching hospitals. So, thus, by providing the teaching or the training in the hospitals to the nurses or to the doctors, it is stimulating in the growth of medical science. Yeah. Next is it helps. It develops it develops and maintain an effective system of clinical and administrative records and reports. Yes, for maintaining an effective system, it is very important to maintain records and reports. And it also participate in the financial planning for the operation of the hospital. It provide facilities for continuing education of all persons. It also participates and put into practices the safety programs of the hospitals. It initiates and utilizes and participates in research projects which are designed for the improvement of the patient care and the other hospital services. Next is the classification. The classification here is based on the type of care it is providing. Based on type of care, it is further divided into three types: primary, secondary, and tertiary. So generally, a primary hospital means these hospitals will be giving day to day healthcare, which will be given by the healthcare provider. And this provider, or you can say, or this primary care hospitals will be acting as the first contact and the principal point of continuing care for patients within a healthcare system. This primary care hospital will be acting as a primary care sorry first contact and principal point for providing care to the patients, and it will coordinates with other specialists in the healthcare system that the patient may need. It also provides a basic health care. It is regarded as the gateway for receiving more specialist care. Example for primary care hospitals are the walk-in clinics. Next is secondary care hospitals. Secondary care hospitals are generally specialized care or which will be requiring more sophisticated and complex diagnosis and treatment, which is when we compare this secondary care with the first healthcare level, and it will be involving hospitalization, and it will be having 50 to 200 bedded system. Thus, it is acting as a support referral system for primary health care. Example for secondary care hospitals will be patient wards in general hospitals. Next is tertiary hospitals. These level of care will be dealing with the higher specialized services which will be provided at the regional or at the central level. So these centers will be specifically designed, staffed, and equipped, and it includes the teaching hospitals or super specialized hospitals like cancer hospitals, mental hospitals, or chest hospitals. The teaching hospital example for tertiary level is AIMS. Next is these institutions means the tertiary level care will be the referral support for the primary and the secondary level health care. Next is based on clinical service. Based on